The doubling rate is quite astonishing. We are also possibly dealing with variants which are far more infective, that is contagious. All the information we were getting that you should abstain from alcohol for 45 days, there's absolutely no evidence for that. We're clearly in the middle of another surge, and obviously the metropolitan centers are going to suffer quite a bit. You're seeing a remarkable number of escalation in the infections, and the doubling rate is quite astonishing. So I was reading that the doubling rate in Mumbai is about 5 to 6 days. The doubling rate in Delhi is about 7 to 8 days. Even in smaller areas such as Goa, the doubling rate is about 16 to 17 days, which is something to worry about, which clearly means that we're in the midst of reinfections, some of them. We are also possibly dealing with variants which are far more infective, that is contagious, than the original SARS-CoV-2 that probably entered India. So, and frankly, that's exactly what is expected from respiratory mucosal pathogens. So you will find that even with the flu pandemic of 1918, there were three kind of peaks. There was the first peak, which was in roughly the spring of 1918, which was a small peak, followed by a really massive surge and a massive peak in the autumn/fall/winter of 1918. And then there was a third peak, which was in the spring, in the subsequent year in 1919, which was roughly intermediate in intensity between the first and the second peaks. And in most metropolitan areas of India, for instance, you're seeing something similar. We had the first peak, which was in spring and possibly summer of 2020, which extended all the way till July. In Delhi, for instance, there was another massive peak around and after Diwali. And now we're beginning to see the third peak in the spring of 2021. You've had peaks and you've had troughs and you've had plateaus. And fundamentally, what you see with these infections is entirely controlled by the interaction between the host and the pathogen. Okay, what that means is that government intervention will play a limited role. It will flatten the curve, to use that cliche, but the area under the curve will remain the same. What that means is that fundamentally you might have a steep curve or a flat, longish curve, but the area under the curve, the number of people infected, will remain the same. So government intervention is fundamentally to prevent a steep curve, so that healthcare services are not overwhelmed. But the total number of people infected in any community or any nation will be the same unless help comes in the way of mass vaccinations before herd immunity due to natural infection is achieved. It's been a slow start. I don't think we should go by the absolute numbers that have received the vaccine, which would be about 5 crore. We should consider the percentage, the fraction of the national population that is vaccinated. Now, ours is largely a young country. I think the important thing to consider is that just 8% of our population is above the age of 60. About roughly 5.5% to 6% of our population is over the age of 65. In fact, an astonishing bit of statistic was that almost 60% or more, or 60 to 65% of India, was born after liberalization, after 1991. So it's largely our population is the demographic constitution is such that most of our population hasn't been vaccinated. And the important thing is that you must vaccinate as many people as quickly as possible, because if you're not doing that, you are putting pressure on the virus via mechanisms of natural selection to mutate and acquire immune escape, to confer immune escape. So natural selection is going to dictate how the virus is going to behave from this point on. So this has to happen simultaneously with different demographics. You need to vaccinate very quickly, as much as possible. And it's also important that other countries should be doing the same, because it doesn't. So Israel, for instance, even if it manages to vaccinate its entire population, there's always a possibility that a variant which has been conferred with immune escape, which manages to evade the immunity generated by the vaccine, could be infecting a person, and this person could be sitting in a plane and then flying in, and there it goes all over again. So this has to be a global phenomenon which happens simultaneously across communities, across nations, and that's important. We must have a plan of, there was some speculation that we were planning to get 80% of our population vaccinated by December 2021. Now, for that to happen, we need to really ramp up supplies, and we really need to open up more centers where individuals can be vaccinated. Luckily, it doesn't take a lot of technology to administer vaccines that are currently being used in India. So both the ones that are available currently, Covishield and Covaxin, can be transported and stored at fridge temperatures, which is 2 to 8 degrees centigrade. And all you need is a trained nurse to give the shot. You need some support staff, and you need some amount of backup, medical backup, in case someone were to develop an acute anaphylactic reaction or some kind of allergic manifestation. But that's all you need. It's not, you don't need great infrastructure to store or administer these vaccines. So I think you should be engaging the private sector, and also exponentially ramp up supplies, so that you can open up the vaccination drive to more and more people, even under the age of 45. Look, you have to realize that one section of our population, which would mean the children and the adolescents, are completely naive to the virus. They've been kept locked up to this day. Schools are shut. Colleges are not opening up for in-person attendance. And so this fundamentally, particularly the children, these would be considered virgin soil. They've not been exposed to the virus, most of them. And therefore, at some point, you would have to consider vaccinating children as well. So there aren't any specific things that you need to worry about. Firstly, I think everybody should get vaccinated, unless there is a specific allergy, as the insert of the vaccine states, to any of the constituents of the vaccine. But nobody knows what the constituents are. So, I mean, if you don't have a known allergy to previous vaccination, I don't think you should be avoiding the shot. Because most centers where the vaccine is given, you have trained medical personnel to take care of any allergic manifestation or anaphylaxis that might happen as a consequence of this. But I think just get a good night's rest before you get the shot. Don't have alcohol the night before and for a couple of days at least, because that might affect the immune response. There's some evidence to suggest that, but all the information we were getting that you should abstain from alcohol for 45 days, there's absolutely no evidence for that. There is some concern about a subset of people who are on a kind of blood thinner, which is known as an anticoagulant, which needs to be stopped for possibly a couple of days or more before you take the jab. And that is not because it's going to react with the vaccine in any way, it's just to avoid any bleeding at the site of the injection. If you're on very strong blood thinners. But apart from that, I think you should just make sure that uh, you know uh, uh, you adequately hydrate yourself and rest. And if there are any minor side effects, just consult your physician if anything in particular needs to be done. But it's a pretty straightforward vaccine. We've got enough real world data now across the world that it's not producing any major or serious or bothersome adverse effects.